Gentleman from Tennessee is recognized.
Thank you. Thank you very much, Mr. Chairman. And I'll make it clear that I have no complaints about or criticisms of Ms. Ingram, but in Forbes magazine just this morning, it says a columnist named Avik Roy wrote this. He said, 1 week into the launch of Obamacare, however, it's not a joke. It's literally easier to blog from the Kenyan border than to sign up for insurance on Obamacare's federal exchange. Why is this happening? Politics. The Obama administration was more afraid of delaying the launch of Obamacare than they were of botching it. All you need to know about the rollout of Obamacare's subsidized insurance exchanges is that so far the toughest questions posed to the Obama administration have come from Comedy Central. We're going to do a challenge, Jon Stewart told Kathleen Sebelius on the Daily Show. I'm going to try and download every movie ever made, and you're going to try and sign up for Obamacare, and we'll see which happens first, unquote. Some of the last questions made it seem that maybe done sort of in a joking manner, but this really is nothing to joke about. It's really kind of sad that this law was signed into effect in March of 2010. 42 months the government employees have had to prepare for this, 3.5 years. Ms. Ingram's been working on this in December of 2010, and since December of 2010, and once again, I've got no complaints about Ms. Ingram. But I think it's kind of ridiculous or kind of sad that after all this time, things are in the shape that they're in. And also, I found out this morning that the taxpayers have paid over $400 million in sweetheart deals to government contractors to help all the government employees who've been working on this to try to get this in shape. I mean, this is the most messed up, convoluted, confusing law that I think has ever been passed. And even before this rollout, as bad as it's been, thousands and thousands of citizens across this country have written and emailed and called members of Congress. I've got I could bring so many examples, but I've got one that says, I'm a retired TVA employee and received notice of a more than $500 increase in monthly health insurance starting in 2014. Monthly premiums will be $1,495 per month for me and my wife. Went into the Affordable Care site, and premiums are about the same, except none of my doctors are on the list. I encourage you to keep voting to defund Obamacare, vote against increasing the debt ceiling, and vote to include everyone in Obamacare. No waivers and our credits. My slogan for President Obama is, be a man, sign up for your own plan. That was from Jack H. Weiss. Then another man, Joseph Smith, emailed me. I remember our president saying the new health care bill will reduce costs. I have my health care renewal forms, and the premium is increased about 15%. A $700 deductible is added, and my copayment is increased. Drug coverage is also increased. Maybe you can do nothing about this, and I understand. I just want you to know that I feel as if the truth was not told. And another example from Bruce Christopher, it says, my 2011 health insurance premium is going up 11% for less coverage. Copay and deductibles have doubled. Just thought you want to know. Now, you've got your responsibilities, and the IRS commissioner, Mr. Schulman, was here earlier, and also he said he noted that the statute does not allow traditional enforcement methods. But he said that the IRS will, quote, communicate with the taxpayer in an attempt to resolve the outstanding liability. Can you tell us, since you're in charge of this office, Ms. Ingram, how will the IRS communicate that information to taxpayers?
I believe then Commissioner Schulman was referring to the individual payment provision. Is that right? Right.
That's correct.
So the traditional parts that are not available to us per the statute is that if there is a liability related to that provision, liens and levies and any criminal steps cannot be used for that provision, and we are operationally making sure that that is absolutely true as it rolls out. If somebody is not covered, which most Americans are, or they're not eligible for an exemption, a statutory exemption, which another group is, if they actually have a liability and do not pay it as part of their return filing process, it would be a balance due like other balance dues. And we're very conscious that in the early time, education to be done.
Well, how will you identify the people who haven't complied? I mean, are they supposed to check a box on their tax return, or what's going to happen?
We received a great deal of feedback that it would be helpful to Americans who are covered to be able to check a box and know that they were done. So our intention is to give people an easy way as part of their tax filing process to check a box or indicate the exemption that they qualify for, or to calculate the penalty as part of their return filing process.
And now you know that all these employer mandates have been delayed. And it was my understanding that the IRS was going to use the information obtained in these employer mandates to do your required compliance work. So were you going to use the information from that these employers provided?
So the information that's relevant to this provision is the information coming from the insurer information reports. And for the first year, the Congressman is correct that that is not mandatory in the first year. We are making sure citizens have the information they need to fill out their returns correctly and honestly, which most taxpayers do, I'd like to emphasize. And we will be looking to see whether there are other ways to look at the filing patterns. But our main concern in the first year is to make sure people are educated and know what they need to do.
Well, my time's expired.
And in the second year, we'll have the returns.
I just want to say that I feel this is not a joke to the American people, and it's sad that we would have laughter and jokes here in this committee hearing, in my opinion. Thank you.
Thank you, gentleman. Gentleman from Pennsylvania is recognized.